Good morning, everyone. For weirdest tweet of the year, Andrew Scheer gets that prize so far, and it's early, so I may give it again. But this is, kind of weird. I don't think I've ever seen him talk about Brexit. He's not a nationalist. He's a globalist. So I don't get it. I don't get why he's tweeting this, but he's tweeting this, quote, "It's almost time," and he's tweeting to a Brexit countdown, 5 minutes. And he got like 500 likes, 532 likes. It's just a weird tweet. I don't get it. But Brexit happened yesterday, or midnight yesterday or whatever, and it was a big deal and everybody was happy about it, and it happened. It went through. So I think that's worth noting. Nationalism is rising. It's interesting. Not so much in Canada. It's very slow in Canada, like our response to the coronavirus. And here is CTV Power Play. This whole clip is really interesting. She starts out talking about how she'd wear gloves and a mask, and Evan pushes her and says, You're representing the government of Canada. Are you just freelancing and telling us what to do?" Like, he doesn't say like you're our mom, but I kind of got the impression like just as a favor, like you're the representative of the government, and we want to know what the government and the government's position is. That's what we want to know. So this clip is strange because she's off her feet, and well, here it is. I'll read the tweet. When asked at Zan Lenore, "What can we expect from the government now that the WHO has declared a global health emergency?" Quote, "I'm telling you that they don't know yet. We're working on it right now," Zan said. It's a train wreck. Here we go.
In a global health emergency. I mean it because I want the government of Canada's view.
I don't know what the government of Canada's view regarding gloves and masks,
okay,
but I do know that they are available, and I do know that people are concerned who are traveling, and I think that they need to look after themselves. Yes.
I know you're rookie MP.
Yeah,
you're on a national program.
Yes.
Canadians are listening to you, and you don't know the government's position. You can't tell us when the plane's going to get there. You can't tell us about quarantine. You can't tell us the government's view. I'm not saying you're wrong.
I'm telling you that they don't know yet. We're working on it right now. It's taking, I believe.
I'm telling you that they don't know yet. We're working on it right now. It's not like this is new. This has been an outbreak since January 1st. This is not brand new, not even a week old. This is a month old, right? Why doesn't the government know what to do? Are they it's very concerning when the government doesn't know what to do. And here's 680 News tweeting, "Canada is seeking Chinese approval to send a plane to the lockdown city of Wuhan to collect the 295 Canadians who have asked for help to leave." Now, yesterday, and I think that this is just a tweet error, it's supposed to be 195. This is nearly 200, it says in the article, and we're going to look at the article in just a minute. But it's interesting that there's a plan for evacuation from the quarantine zone in Wuhan, but there's no plan for what to do with the people once we get them back in Canada. And I was talking about this yesterday, but doesn't it seem like when you've got somebody like Zan Lenore, who should know what the government's position is on these things, these decisions probably should have been made before the wheels got turning on a plane to bring people back from the quarantine zone, what they're going to do with people? They don't know. And it seems really clear on that interview here that they're out of their depth, it seems to me. Here's the third confirmed coronavirus case in Ontario. This is CBC News reporting. And this, I love this line here. "Risk to the public remains low, according to the provincial health officials." Right. Yes. Okay. Here's the article. "A woman from London, Ontario, who is asymptomatic and at first tested negative, has been confirmed as Ontario's third case of coronavirus. Dr. David Williams, the province's chief medical officer of health, said the patient is a woman in her 20s who flew from Wuhan on January 23rd, returning to her home in London by car, where she is a Western University student. Health officials said she did not show any symptoms and wore a mask during the flight and in the vehicle, yet chose to put herself in isolation. Quote, we do have a case here where both the system worked well, and also you had a patient who went above and beyond to protect the public and the people she was in contact with." Dr. Chris Mackey, London's chief medical officer of health. The patient later admitted herself to University Hospital after showing symptoms when she was swabbed and sent home. Right? What is going on? And it's really weird to have this whole paragraph praise the patient for self-isolation and, oh, our system worked really well, they reported, and blah, 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 blah. Like, what about the 10 people who haven't reported who are experiencing symptoms and are afraid to report, right? Like, are those, is that happening? Well, I mean, you decide if the measures that our airports and other places have taken are responsible. And it seems like, well, 10,000 cases in a city of 11 million people is a drop in the bucket. It's not that many cases. But when you compare it to SARS and that outbreak, it's a lot of cases in half the time. So there are concerning markers. I don't want to overstate this, but it's very concerning when doctors are speaking like this. So here's the CBC News article. This was published yesterday, January 31st, 2020, and its title is "Passengers with Nose Running Like Niagara Falls Questions Canada's Airport Coronavirus Screening." Massey Beveridge, a retired general surgeon, said he was waved through Pearson International Airport even after reporting his symptoms to a border service agent. A physician who said he developed a nasty cold with a cough and runny nose while on a flight from Hong Kong to Toronto is questioning whether there are adequate safeguards to prevent the spread of coronavirus in Canada. Massey Beveridge, a retired general surgeon, said he was waved through Pearson International Airport even after reporting his symptoms to a border services agent. "My nose is running like Niagara Falls. I'm coughing and feeling pretty miserable," Beveridge told CBC News. He says he explained his symptoms to the agent and that he was taken to a screened-off area with face masks and hand wash. Quote, "The immigration officer came back a few minutes later and said, 'Here's a handout. You can call public health if you like,'" Beveridge added. "I figured there'd be some kind of public health person coming to interview me." Scroll down a little bit. Beveridge was returning to Canada from Cambodia, but changed planes in Hong Kong after flying from Phnom Penh. Sorry if I got that wrong. He said he was anxious, even though he had not been anywhere near Wuhan. Cambodia has so far reported only one case of the coronavirus, and it was travel related. Additionally, given the concerns over the coronavirus in China and other Southeast Asian countries, he figured he'd better do something on his return to make sure he didn't spread whatever he had. Quote, "Nobody even took my temperature. And if we're really trying to keep this out of Canada, it seems like that was not a very thorough screening process," Beveridge said. Scroll down a little bit more. CBC News reached out to the Greater Toronto Airport Authority, GTAA, the body that oversees Pearson, for comment. A spokesperson said the Public Health Agency of Canada is responsible for determining the response to the coronavirus. Canada began implementing some enhanced screening measures for passengers on flights from China to Toronto, Montreal, and Vancouver on January 22nd. They include signs urging travelers to report flu-like symptoms, additional health-related questions at kiosks, and pamphlets with information about what people should do if their condition worsens. And there's a little bit more, but it's a lot of, don't worry, everything's fine. There's no public safety concerns because it's travel-related and blah, 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 blah. So, it's interesting, right? There's lots of information out there. There's lots of conflicting information out there. Who knows? Who knows? And I think that our government's lack of ability to put together a coherent, this is what we're doing, this is why we're doing it, blah, 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 is very concerning. I think it's very concerning. And I guess we're going to play this experiment out in real time. How contagious is this virus? How good is Canada's healthcare system? In the face of Brampton, for example, calling for a healthcare emergency and multiple hospitals being overloaded by 150% or more, or by 50% or more, being at 150 to 170% capacity. That's what I'm trying to say. Not 250% capacity. They're not overloaded by 150%. Okay. Sorry, I know I talk a lot. Thanks for watching, everybody. Check out CanadaPoly.com. Check out CanadaReport.co. I try and keep up on it, but I don't know. I don't know if it's worthwhile. I'm trying. And have a wonderful, wonderful